Hello and welcome to a short presentation on growth hormone deficiency, also known as GHD. My name is Sally Majid and I'm growth nurse specialist here at the Child Growth Foundation. So today we'll be covering what growth hormone deficiency is, what possible symptoms and causes there are of growth hormone deficiency, what type of investigations might be done to discover if someone has a deficiency in growth hormone, and then the treatment and support that's available. And then finally, we'll be hearing from a family about their journey to diagnosis and what life is like day to day for them. So what is growth hormone deficiency and what are some of the possible symptoms and causes? So a hormone is a chemical message that's carried from one cell to another. And growth hormone is produced by the pituitary gland about the size of an almond in the brain. Above that is the hypothalamus, about the size of a pea, and that sends messages to the pituitary gland telling it to make growth hormone. And growth hormone directly actions growth on the growth plates of the bones, but it also acts indirectly by the production of growth factors. And one of those is insulin-like growth factor 1, IGF-1, and that's a protein produced in the liver, and that's the main mediator of many of the actions of growth hormone. Growth hormone also has important effects on the metabolism of proteins, fats and carbohydrates, and it's also involved in the regulation of blood sugar levels in the body. And that's not only in childhood but also throughout adult life. Growth hormone deficiency is when the pituitary gland does not make enough growth hormone to stimulate the body to grow and results in a slow rate of growth in both early and late childhood. It's thought that it is estimated to affect 1 in 3,500 to 1 in 4,000 children. And whilst nutrition has a more dominant role for the baby in the womb in growth, from about 2 years of age, growth hormone takes up its primary role in stimulating childhood growth. Children with growth hormone deficiency usually have normal body proportions, but they'll have short stature. They can appear fuller-faced, maybe a bit chubbier, as growth hormone helps to control the amount of fat under the skin. They may be perceived to be younger than their age when compared with their peers. And causes of most childhood onset growth hormone deficiency is not known, but it could be caused by problems with the development of the pituitary gland or damage caused at birth or by an illness or a head injury. And it's important to remember that not all children who are short have growth hormone deficiency. They may have appropriate height for their family background, their genetic background. So to explain some of the possible investigations that might be done to make a diagnosis of growth hormone deficiency. Now, tests for growth hormone deficiency are usually only considered after there's been a clear, slow pattern of poor growth and that all other causes of faltering growth have been ruled out. An assessment of growth patterns and target height. So children should have their height and weight measured by a professional who is trained in taking accurate measurements. Target height is what the expected height for a child would be as an adult based on what the height of their parents are. And that will be compared to the current height predictor based on what the children's current growth measurements are. Any discrepancies between the two will aid in the assessment of growth hormone deficiency. Baseline blood tests will be done, and also a bone age, which is an X-ray of the hand and wrist, and that looks at the maturity of the bones and compares it with the actual age of the child. The bone age will usually be delayed in a child who has growth hormone deficiency. By delayed, I mean it will be measuring as younger than the actual age of the child. So a single blood test for growth hormone levels is not possible because the pituitary gland releases growth hormones in bursts, usually through the night. And there's something called a stimulation test or a provocation test, and that's done in hospital. And it usually requires the child to be fasted, so not had anything to eat. And then they're given a drug directly into the vein or into the muscle to stimulate the pituitary gland to make growth hormone. And then after they've had the stimulant, blood tests are taken at timed intervals and growth hormone will be measured through those blood tests. And there's also an investigation called a physiological test, and that's done overnight to assess growth hormone production. Blood tests are still necessary, so they take blood tests through the night about every 10-20 minutes and measure growth hormone that way. But that's only available in a few specialist centres, and it's not often carried out. An MRI scan is a scan that will take a closer look at the pituitary gland and to look at see if there's any abnormalities with the pituitary gland. Your specialist will advise and agree with you which investigations are necessary, and not all will be carried out. So, treatment and support for growth hormone deficiency. Treatment is by giving a daily evening injection of growth hormone, and that's to mirror how it is produced normally by the body overnight. And it's usually needed on a long-term basis until the child has stopped growing. Developing a rapport through open, sensitive, age-appropriate information sharing will enable the benefits of growth hormone therapy to be explained. And the benefits include a progression in height, improvement in body composition, bone density, and metabolism. Device choice. The device is the type of injection delivery system that's used, so the type of needle, syringe, or pen used for growth hormone therapy. Getting the right injection device can help with a sense of choice control for the child and family. Your endocrine team will discuss what device options you have with you. Adherence. Adherence is how the patient follows treatment plans. Education around benefits of growth hormone therapy, appropriate support, and device choice are all thought to improve adherence to treatment plans. The team, the endocrine team, will include an endocrinologist and possibly an endocrine nurse specialist, and they'll support you through treatment and follow-up monitoring. Regular appointments will monitor growth and development and will also include blood tests. And there's been recent developments in America where a weekly injection of growth hormone can now be prescribed. It's hoped that in the near future this will be available in the UK too. Support, as we've discussed, like through your endo team, is essential, as you and your child may find daily injections daunting. You may encounter resistance and refusal, so seeking that support is vital. Here at the Child Growth Foundation, we are happy to answer any queries or concerns you may have, and we can also put you in touch with families that are going through or have gone through the same challenges as you.
My name is Jake, I'm 13 years old and I like doing a lot of hobbies. I like working out and I like doing boxing and yeah. When I was 4 I was diagnosed with GHD and I remember it wasn't a really pleasant experience at all as I didn't really understand what was going on. Only later on did I realise how hard it was for my mum and dad to fight for my diagnosis, and it was really tough for me when I was younger because I was my mum and dad were injecting me and I didn't know why and I was really confused, so it was really scary. Yeah. GHD affects my day-to-day life as it used to make me feel a lot like I wasn't normal and I wasn't fitting in because I was really, really small and everyone else was taller. But now it doesn't really affect me. It probably would when I go for sleepovers because I've got to take injections and it's a bit of a hassle, but it doesn't really affect my day-to-day life. In the future, I hope that I can accomplish many things and I hope I can make my wishes about my future life come true, as I know I can do that without having to feel GHD is holding me back, as if I really think about it, it's only a short thing every day that will help me in the long term. I would say make your child understand as much as they can about their diagnosis so they can understand what's going on and not feel confused and scared. You could do this by buying them comics or creative books that could help them fully understand what's going on in a child-friendly way. It's scary at first, but when you get used to it, it's part of your everyday routine, and just try and make you and your child feel calm about the situation, and just live life to the full without having to make that hold you back. For the parents, it has helped my mum and me greatly by joining a group called the Child Growth Foundation, a charity which has really helped my mum make friends and get advice as when she is struggling, and it has helped me get very good friends that me and them can talk about things that we have both experienced as having GHD. This is all part of your learning experience in GHD, so try and keep focused on your child and yourself, and just know this is just a learning curve.